She was coughing. She couldn't catch her breath.
For the Holland family of Manchester, what started as a cough quickly became a frightening experience. Their 7-month-old daughter was checked out at the hospital, and while she did not have whooping cough, doctors ran tests to rule it out.
I mean, there's no shortage of things to worry about with a newborn, but yeah, anything additional is terrifying.
According to data from the New Hampshire Department of Health and Human Services, as of June 30th, the state has seen 63 cases of whooping cough so far this year. That compares to a total of 69 cases in all of 2024.
In 2024, those numbers jumped back up to pre-pandemic numbers.
Dr. Maria Boylan, Medical Director of Primary Care at the Elliott Hospital, expects to see cases this year surpass last year. In August alone, they had 8 cases. She says early detection and vaccination are critical.
The single best way to prevent pertussis or whooping cough is to get vaccinated. So infants under the age of 1 are typically vaccinated throughout their first year of life. They get another dose at 4 years old and another one at 11 years old.
For new parents like the Hollands, every cough is a cause for concern, but staying calm can make all the difference.
So even though you might be going through the ringer with it, it's even scarier for them. So just keep your head about you.
And adults, including pregnant women, are also encouraged to get vaccinated about every 10 years. Reporting live in Manchester tonight, I'm Mike Moses, WMUR News 9.